questions. The member from Hamilton East, Stony Creek.
Thank you, Speaker. My question is to the Minister for Health and Long-Term Care. Liberal cuts to health care are hurting patients in Hamilton, Minister. Hamilton Health Sciences is cutting nearly 100 full-time positions. St. Joe's is cutting 136 positions, and mental health services are being moved out of my riding and out of East Hamilton. Those services are a lifeline for people in need, but now the whole east side of Hamilton will be without psychiatric care. Patients will be asked to take the bus for an extra hour each way to the remaining facility on Mohawk and Hamilton Mountain. And these additional burdens of time and money will only discourage patients from getting the help they need. Will the minister explain to us why this government is making it harder for people in East Hamilton to get the mental health care they require?
Thank you. Minister for Health and Long-Term Care.
Well, Mr. Speaker, I first want to address the allegations, the comments made at the beginning of the member's question with regards to Hamilton Health Sciences generally. We do know that they reviewed 230 different options for finding efficiencies and for staying within their allocation. They decided on a number of those options, of more than 200. They decided on a handful of them. It does result in some job losses, approximately 90, but almost 50 of those are unfilled positions, so the true number is closer to between 40 and 50, Mr. Speaker. The Ontario Nurses Association says, quote, only a very small number, unquote, of the affected jobs at HS are in nursing, Mr. Speaker. There are non-union positions which are being removed as a result of this change. It's an important, I think we need to recognize, Mr. Speaker, we need to give the tools to our hospitals to make the changes they deem necessary to provide the best quality patient care.
That's right.
Supplementary.
Interesting. Speaker, RNs, RPNs, social workers, child care workers, technologists and lab staff and many other workers are all threatened by cuts at St. Joseph's, and they know the impact this will have on their community. The closure of the East Region Mental Health Services is a body blow to my riding, which is the second poorest in Ontario. Minister, poverty breeds poor health, including mental health. This clinic exists to provide community-based support. Instead, we're asking people to travel an hour each way out of their community to get help. Gary Birch from Bimbrook contacted my office and pointed out that these patients have reached a mental or financial state such that they can only access a mental health service that is near them. They will not venture very far. Yet this government is telling them to hit the road. This pattern of short-term cuts with long-term costs and consequences is the hallmark of this Liberal government, and it is occurring across our province. How long will patients in Hamilton have to suffer just because the Liberal government can't get its priorities straight?
Thank you. Minister.
Well, thank you, Mr. Speaker. My understanding is that this is one of the changes that St. Joseph's is contemplating to its mental health system. Of course, we know on the mountain there is a more than $1 billion investment in mental health services that provide support to people not just from Hamilton but for the entire region, Mr. Speaker. And we need to also acknowledge the importance of moving those programs and services and supports out into the community, and we've been doing that through an investment of $20 million over 6 years in the Medical Psychiatry Alliance, which is going to provide tens of thousands of individuals better access to mental health services. Or I'm surprised that the member doesn't talk about the Mobile Crisis Rapid Response team that's set up in Hamilton, which has ride-alongs of mental health workers with our police officers, so that if there is a mental health crisis involving somebody who otherwise would end up in the justice system, they get involved. They often divert away from hospitals to begin with to provide the important community supports that also keep that person out of prison.